Standard Occlusion Theory for TMD. I am Sotokawa, a dentist practicing in Morioka City, Japan. This theme covers the occlusion theory essential for treating temporomandibular joint disorders, organized into the following 24 topics. This time, I will explain the 10th topic. Occlusal Analysis. 10. Occlusal Analysis. Contents. Introduction. 1. Occlusal Analysis at the centric relation. 2. Relationship between centric relation and intercuspation. 3. Occlusal Analysis of the mandibular lateral position. 4. Occlusal Analysis of the mandibular protrusion. 5. The significance of simulated occlusal adjustment. 6. Methods for simulated occlusal adjustment. Introduction. Occlusal analysis involves examining a patient's bite to determine the presence of abnormalities. Occlusal analysis can be performed within the patient's mouth. However, to obtain detailed occlusal analysis information for establishing a treatment plan, it is necessary to perform the analysis on models mounted in a semi-adjustable articulator. This time, we will specifically explain occlusal analysis by comparing intraoral analysis based on centric relation, mandibular lateral relation, and mandibular anterior relation with model-based analysis. Furthermore, we will explain the method for simulated occlusal adjustment and how to document the occlusal analysis report. 1. Occlusal analysis at the centric relation intraoral. Place the patient in the supine position. As shown in the upper right photograph, hold the mandible with both hands and guide the mandibular condyle into a stable position within the mandibular fossa. Once the mandible is guided to the centric relation position, perform axial movement of the mandible using the temporomandibular joint as the axis. After confirming axial movement, slowly bring the upper and lower teeth into contact and confirm the contact points through questioning. For example, asking the patient which side makes contact first, the right or the left. Allows the patient to recognize the early contact points. As shown in the photo on the right, occlusal analysis in centric relation involves identifying and recording the early contact points using bite registration paper. When the mandible is guided into centric relation and the teeth are brought together, if multiple teeth make stable contact, or if the deviation between centric relation and occlusal contact is minimal or non-existent, the relationship between centric relation and occlusal contact is considered normal. 1. Occlusal analysis at the centric relation on models. Shift the incisal pin upward to prevent its tip from contacting the table. As shown in the upper right photo, early contact in centric relation can be recorded by interposing bite paper between the upper and lower jaws and lightly closing the upper arch on the articulator. As shown in the lower right photo, when early contact exists in centric relation, no other teeth contact each other. 1. Occlusal analysis at the centric relation intraoral. The illustration on the upper right shows the mandible guided into centric relation. Generally, when a patient's mandible is guided into centric relation, the midlines of the upper and lower jaws align. Afterwards, the patient is instructed to bite down firmly to establish the occlusal contact position. If no anterior-posterior deviation from the midline is observed at this point, and the centric relation and occlusal contact position coincide, this is considered normal. On the other hand, after instructing the patient to bite down firmly, the midlines of the upper and lower jaws may shift, as shown in the illustration below right. In such cases, confirm the direction and millimeter displacement of the occlusal contact position relative to the centric relation. The analysis of the relationship between the centric relation and the occlusal contact position involves measuring and recording the existence, direction, and distance of this displacement. For example, record it as the occlusal contact position is displaced mm in the direction from the centric relation. 2. Relationship between centric relation and intercuspation. As shown in the upper right photo, confirm the occlusal state of the model in the centric relation position. Next, as shown in the lower right model, hold the incisal pin and find the mandibular position where as many teeth as possible can bite stably. That position is the occlusal contact position. Confirm and record how much and in which direction this occlusal contact position deviates from the centric relation position. Furthermore, as shown in the photo below, by observing the left and right condylar spheres' red arrows on the articulator, you can also confirm the positions of the left and right mandibular condyles in the condylar occlusal position. 3. Occlusal analysis of the mandibular lateral position. As shown in the upper and lower right photos, guide the mandible laterally and check whether the incisors on the working side, especially the canines, make contact. In a normal occlusion, the incisal edges of the upper and lower canine teeth on the working side make contact, allowing them to bite through meat or thread. If anterior tooth contact is not achieved with the mandible in the lateral position, insert bite paper between the molars on the balanced side, as shown in the upper right photo, to confirm early contact on the balanced side. If early contact cannot be confirmed on the balanced side, insert bite paper between the molars on the working side, as shown in the lower right photo, to confirm early contact on the working side. Once early contact is confirmed, record the location. 3. Occlusal analysis of the mandibular lateral position on models. As shown in the upper right photo, slide the upper arch of the articulator laterally to check if the anterior teeth make contact. At this point, verify that the working condylar head of the articulator is in contact with the posterior wall, as indicated by the red arrow in the lower photo. If anterior contact is not achieved, determine whether the early contact preventing it is on the balancing side or the working side. Additionally, as shown in the photo at the bottom right, inserting bite paper allows for more detailed confirmation of the location of occlusal interference. 4. Occlusal analysis of the mandibular protrusion. In a normal occlusion, as shown in the upper right photo, when the mandible is protruded forward, the incisal edges of the upper and lower anterior teeth make contact, enabling the biting through of noodles and similar foods. When malocclusion exists in the mandibular protrusion, the anterior teeth do not make contact when the mandible is protruded forward. Consequently, the anterior teeth can no longer bite through noodles, inducing nocturnal bruxism and causing dysfunction in the lateral pterygoid muscles. In occlusal analysis for mandibular protrusion, as shown in the photo on the right, we identify and record the points of premature contact on the molars that prevent anterior tooth contact when the mandible is protruded forward using bite registration paper. 4. Occlusal analysis of the mandibular protrusion on models. As shown in the photo on the upper right, slide the upper arch of the articulator backward to position the mandible in an anterior position. At this point, check whether the anterior teeth make contact. If they do not contact, insert bite paper as shown in the photo on the lower right to identify and record the occlusal interference sites on the molars, causing the interference. 5. The significance of simulated occlusal adjustment. The greatest advantage of occlusal analysis using a semi-adjustable articulator is the ability to perform simulated occlusal adjustments on models before initiating treatment. The information gained through simulated occlusal adjustments can be summarized in the following 2 points. A. The treatment procedure becomes clear. B. By clarifying the occlusal state after treatment completion, treatment goals can be established. 5. The significance of simulated occlusal adjustment. The black areas on the upper right model indicate the areas requiring reduction. This case demonstrated that eliminating early contacts at several reduction sites is feasible, and that the malocclusion can be resolved through simple occlusal adjustment. The lower right case clearly shows that the reduction sites extend to multiple mandibular molars. This is a case where most of the molars must be reduced to eliminate the premature contacts. As shown in these examples, simulated occlusal adjustments reveal the occlusal state after treatment completion. 5. The significance of simulated occlusal adjustment. Other treatment options. Simulated occlusal adjustment on a model confirmed that occlusal adjustment was an appropriate treatment plan for the patient. However, in cases of complex malocclusion caused by disruption of the occlusal plane, occlusal adjustment may not resolve occlusal interference. In such cases, a treatment plan involving the reconstruction of the entire occlusal relationship, known as oral rehabilitation, is adopted. In other words, simulated occlusal adjustment can reveal that a patient's malocclusion cannot be addressed by occlusal adjustment alone, necessitating the selection of an alternative treatment plan. Therefore, simulated occlusal adjustment plays an extremely important role in establishing the treatment plan for occlusal disorders. 6. Methods for simulated occlusal adjustment. Occlusal analysis is performed for centric relation, mandibular lateral position, and mandibular protrusion. Simulated occlusal adjustments are similarly performed on models for the following items. A. Elimination of centric relation premature contact. B. Elimination of mandibular lateral occlusion premature contact. C. Elimination of mandibular protrusion occlusion premature contact. We will explain the specific methods for each simulated occlusal adjustment. 6. Methods for simulated occlusal adjustment. A. Elimination of early contact at the centric relation. Centric relation occlusal adjustment involves placing occlusal paper between the occlusal surfaces of the models and biting down, as shown in the right photo, to identify early contact points in the center position. The interference arrow is resolved by reducing either the maxillary or mandibular surface. Eliminating occlusal interference at the centric relation takes precedence over all other occlusal adjustments. B. Elimination of early contact in mandibular lateral position. Move the upper arch of the articulator laterally to position the mandible in the lateral position. At this point, check whether the working side anterior teeth, especially the canines, make contact. If they do not contact, determine whether the occlusal interference preventing contact is on the balancing side or the working side, and record the location. As shown in the illustration on the right, early contact on the balanced side involves functional cusps contacting and interfering on both the maxillary and mandibular arches. In this case, reduce the interfering area on one side to ensure occlusal contact for the working side anterior teeth. As shown in the illustration below right, Premature contact on the working side occurs when the lingual cusp of the mandibular molar or the buccal cusp of the maxillary molar is too high. Therefore, the interfering area on the lingual cusp of the mandibular molar or the buccal cusp of the maxillary molar on the working side is reduced to ensure occlusal contact for the working side anterior teeth. C. Elimination of mandibular anterior occlusion premature contact. As shown in the illustration at the top right, even if there is a portion protruding from the occlusal plane on the mandibular eighth tooth, no abnormalities may be observed in the centric relation or intercuspal position. However, as shown in the illustration below right, moving the upper arch of the articulator posteriorly to simulate a mandibular protrusory position prevents anterior tooth contact. In such cases, identify and reduce the interfering areas of the molars obstructing anterior occlusal contact to ensure anterior contact. Do not reduce teeth on both the maxillary and mandibular arches during this process. In this case, reduce the distal portion of the mandibular eighth tooth protruding from the occlusal plane. Standard occlusion theory for TMD. 10. Occlusal analysis is now complete. If you enjoyed this topic, please click the like button. If you have any questions or concerns, please write them in the public comment section below. The next topic is the 11. Occlusal equilibration.